Hello, this is Dr. Paul Bungie. I had talked a little bit about hydroxychloroquine and some evidence for and against that. But I wanted to talk about Dr. Immanuel's video from several weeks ago. Um, this the hydroxychloroquine by itself is not the whole story. Why did this get so much press, and why did this affect us so much? And I think there's a lot of factors involved that people are not generally thinking about. Her video brought up a lot of feelings and thoughts for people, me at least. You know, we all want to do something, especially doctors. We want to do something for COVID-19. We don't want to fight it. Another thing is, what is primary care's usefulness now? What is our role? I feel that question a lot. Or is it just the specialists have a say in medicine, or does primary care have a say? What are the limitations of the very good science that we have? What are the limitations of randomized controlled trials? You don't do it for everything. What's the meaning of the doctor-patient relationship? Is there a meaning now, or can we just get information and we don't need a doctor? What is the meaning of a doctor? What does it mean that medicine has changed so much, especially with the deluge of information and the internet? How do we manage this? How do we think about it? How should people treat each other online and when they're in debate? And what about ad hominem attacks, when people are attacked for their person or what they might have said before, instead of actually talking about what they're saying now and debating the issue? How can you have a voice when so many voices are out there, and who is actually listening? And will anybody listen to each other? And can we have human relationships? Are we doing the right thing with COVID? Should we be locking up people? Should the NBA be a Wii game? All of these things are tough. And people are dying. What does that mean? And when is death acceptable? And how old is it okay if somebody, if a bunch of people die from COVID and if they're old? And these things are hard, and they go to the core of who we are as human beings. We are all mortal, and these are tough issues. I think Dr. Immanuel's speech brought up a lot of this kind of issues in our hearts. And I think that's one reason it was very shared, not just the hydroxychloroquine. And I would say that I think we need some sort of shared discussion and shared thoughts and shared feelings in this time. I think, and I have a lot of mixed feelings about taking the video down off of Facebook, and even though I disagree with her conclusions on hydroxychloroquine completely. Just a couple thoughts. I'm Dr. Paul Bungie.